Double mastectomy reconstructions. What's the difference between a DIEP flap and a TUG flap or a DUG flap? The DIEP flap is more common, and it's where they take the stomach tissue and the fat, a little bit of muscle, and they convert that into a breast for a natural reconstruction with your own tissue after a double mastectomy. My sister had a DUG flap, diagonal upper gracilis muscle, the fat from your thigh, thin layer of muscle, and they turned that into a breast with your own tissue. A TUG flap is a transverse upper gracilis where they cut across, and a VUG flap is where they cut vertically a flap. Microsurgeons have very creative ways of making a breast for reconstruction if you want to use your tissue. The steps for reconstruction still requires a full mastectomy with expanders. You have expanders because after mastectomy, there will be breast tissue removed, and you may have additional tissue removed to remove all of the cancer and get good margins around wherever your tumor is or area of concern. You will undergo a very long surgery in which they will take the tissue and take that and transplant the tissue from your leg into the breast area. Now, this is a two-step process. You'll have a V-shaped or diamond-shaped incision, and so you'll have two scars after the surgery. This is because they need to make sure that the tissue transfer will survive. That means that while they're taking the tissue from your leg, they are connecting all the blood vessels into your chest, and that tissue needs to stay alive and be correctly healed as the tissue was when it was in your leg. That way the tissue stays alive. Typically at a later date, it could be a few weeks or maybe a month, what they'll do is you'll go back into surgery and then they will close this up so you only have one scar across the breast. A consideration for DUG or TUG flap surgery is that if you're doing a bilateral mastectomy, you do have to cut both legs. So you're gonna have one flap coming from one leg and the other from the other leg, where a DIEP flap, you're taking one panel off of your stomach. Another consideration is finding a specialist, probably a microsurgeon who has experience in flap reconstructions. You want to make sure that this surgeon has a lot of experience doing this and that they have some before and after pictures that you can look at and compare. And make sure that they have patients with similar body types to yours so that you can get a very good picture of what you might look like at the end. This would be the same way you would look for reconstruction for implants as well. Any other questions about DUG or TUG flap? Let me know in the comments.